I know it's evening for some of you across Canada. So thank you for that warm introduction and for the invitation to be here with you this evening, speaking about a topic that I am quite passionate about. So in the 8 years that I have worked with InspireHealth, I've had the privilege of not only being able to support patients one-on-one in my work there, but also to be able to lead many groups, many patient groups, and some groups with community members and some group with fellow healthcare professionals. And the topic that we are often asked to speak about is stress reduction. And one of the things that we often talk about when we're talking about stress reduction is mindfulness and all that it has to offer in that area. So I'm going to be sharing a presentation with you this evening. There's some moments along the way where I will invite you to, try out a practice or a breath or two, but just to say that these are all optional opportunities, and there's absolutely no pressure. And if tonight your best approach is really just to listen rather than engage with those invitations, then please do listen to your wisdom. So I'm going to share my slides. Okay. So I'll just start by saying that you heard my background in Stephanie's introduction, but I am a contractor. So I do work for InspireHealth or with InspireHealth. So that is my only bias or disclosure to be here with you this evening. So here's what we're going to be exploring and talking about over our time together. First of all, I'm going to provide some background as to, why I'm giving this talk, and I think I already started that off in my introduction. And then I'm going to be talking about what is mindfulness. So, this might be, there might be some of you joining for whom this is, not a brand new concept, and in which case there might be hopefully some, reminders or maybe a different perspective. And for some of you, this might be new territory. So we're going to talk about what is mindfulness, why mindfulness. So why would we be potentially, interested in pursuing these practices? And then we're going to talk about some specific tools and practices that could be of support, or it could be, some new ideas for you. And we're going to end with some resources. And as I say, along the way, there'll be a couple of invitations to try some things out. So I'm just going to first tell you about InspireHealth, because that might be a new organization for some of you. We are based in British Columbia, as you can see, but we do provide services across Canada. We were founded back in 1997 by 2 medical doctors. So almost 24 years ago this month. And we have been a nonprofit for that entire 24 years. So that's how we were set up by these medical doctors who really saw a need in cancer care for an integrative, supportive approach to supporting individuals with cancer and their families. We have been partially funded by the BC Ministry of Health for those 24 years, which we are continually grateful for. And because that funding from the BC Ministry of Health is designated to support, us having the clinical team that we have, which I will mention our clinical team in a moment, we do rely on grants and community support to sort of make the whole organization run. So that's how we do things. We don't have any fees either for patients or for support people to engage with our services. So that's important to mention. We see anybody with a cancer diagnosis, and that can be any type of cancer and at any stage in the process. So maybe they've just received that diagnosis, maybe they're in treatment, maybe they're post-treatment. So any stage along the way, we can be here for them. And really our model of care is to support people to play an active role in their cancer journey, and that can look very different for different people. Certainly, for some people, they connect with our services to get some emotional support. For some people, it's about getting more active and doing that in a way that's safe for them. For some people, it's about trying to get a better night's sleep. For many others, it's about looking at maybe ways to reduce their stress. So active role can really mean so many different things for different people. And everything that we offer here, and I'm just going to give you a little taste to start about the kinds of things that we offer. We use the evidence that's out there in the medical literature and in the healthcare literature to build that programming. And then, of course, we do stay up to date because things do change over time, and there's always new research coming out in this area. So that's how we set up and continually refresh and update our programs. The Vancouver Centre has been around for the 24 years that I mentioned, and Victoria has been open for about 10 years, and Kelowna for almost 10, just under that. And then, of course, in the last year, as you might imagine, our virtual center, which we've had one for many years. We've had some virtual programs running, and we have been able to connect with people virtually through telephone or video conference for some time. Well, that just exploded during COVID, and we basically transitioned all of our programs that we were running in center online, and that's what we've been doing for the last, I've lost count of how many months now, 15 months. So it's really been well received and a great opportunity for us to be able to support a wider range of people. Many people living in more rural and remote locations who would have never been able to access us in person, and then of course a more national audience as well. So it's been the silver lining of this past period of time. So this is our model of care, and this is something that we feel so passionate about. This, what we often refer to it as the whole person support to cancer care, and certainly it's what we are using to provide our services here at InspireHealth, but also what we're seeing is the evolution of cancer care across the country and across the continent, is this recognition of how so many things work together and how things are integrated for a person. So in this model, it's important to say that we include, of course, because many of the patients that we're seeing, in fact, almost all, are receiving some form of targeted cancer therapy, whether that's a systemic therapy like chemotherapy, radiation, surgery, sometimes multiple or all three of these areas of care. And the services that we provide integrate with that to support the whole person throughout their cancer process. So through treatment and beyond, to be the to support their healing and to enable them to be able to navigate through that cancer process with the best quality of life and the best way that they possibly can. So I'll use an example of when we're able to support somebody with exercise through their chemotherapy treatment. We know that there are many things that can happen there. We know that we can improve mental health. We can decrease some of the side effects associated with the treatment, including the fatigue and the pain. The literature shows us that we see higher rates of chemotherapy completion when somebody is able to be supported with some exercises that they can continue through the treatment. So that's an example. And one of the areas that we focus on a lot at InspireHealth are these mind-body practices. So that's certainly what we're going to be focusing on today, and it's a huge part of our programming here at InspireHealth. And just to quickly mention that our model of care, and certainly it's a model that we see, as I say, really being integrated into cancer care across the country, is really to think about a support model where a person feels really well supported by a team of health professionals, that there's dialogue and communication between those health professionals, and then that and also that dialogue is going both ways between the person receiving support for their cancer and the providers, and that the person feels really empowered and well supported, not alone, and can make their best decisions with that, from that stance of empowerment. So that's a really important part of the model of care as well. And I'll just quickly say before we drop into talking specifically about mindfulness today, that this is our team here. So we have supportive care physicians like myself, we have clinical counselors, registered dietitians, and exercise therapists. And all of us are able to be one-on-one, provide one-on-one private sessions with a patient who has a cancer diagnosis. And there's the initial 60-minute visit, but there's also the opportunity to have follow-up visits as well. That can be on the telephone, that can be over video conference, and really that's up to the patient to decide what's best for them. And then we offer a lot of classes every week. So somewhere between 18 to 20 classes a week we run, and those are classes, mindfulness classes, so guided meditation opportunities, the yoga classes of several types, there's strength and stretch and aerobics classes, there's art therapy workshops, there's nutrition education like cooking classes or nutritional learning workshops, there's self-care opportunities. So we do a session on mindfulness, we do a session on compassion. I'll mention at the end that we have a session on mindful communication coming up next week. So lots of aspects of self-care, and then lots of cancer education aspects as well. So here is my transition point here. And I put this picture specifically because this is from a lake in rural Nova Scotia. And it's one of my happy places. It's the land from which this picture is taken is a little piece of land that my parents have owned since I was a very young child. And I have the opportunity, I'm very fortunate to have the opportunity most summers, although not last summer, to visit and to take this in. So this picture is positioned by my door in my house. And one of the things that I do every time I see this picture on my way into my house, on my way out of my house, is I stop and I take 3 breaths. And this is I call it bookending my day, generally. Most days, sometimes on the weekend, I have to put a special reminder to go stand by it for a moment to start my day. But it's an opportunity to remind myself how important it is to take a pause and to take a breath. And it's also quite empowering because it is amazing how easily our body's system of, whether it be relaxation or that part of our nervous system I'll be talking about a little bit more, our parasympathetic nervous system, as we go along today, can be activated by even a couple of breaths. So sometimes when I'm feeling up to it, and please join me if you'd like, I will even put my hand, I'll put one hand on my belly and one hand on my chest. And I'll follow 3 breaths in and out. So I'll follow the breath through the rise of the chest and the rise of the belly, and then the fall of the belly and the chest. And I'll do that 3 or 4 full breaths. There's absolutely no wrong way to do this. You don't need to have your hands on your body if you don't like that. Sometimes it just, for me, it kind of grounds me and reminds me what I'm doing, little touch reminder of what I'm doing. those are called diaphragmatic breaths. And those, 3 or 4 of those breaths activates a nerve in your body called the vagus nerve. And that's one of the most powerful nerves in the parasympathetic nervous system. And right there, you've activated that system and set yourself up for a really nice way to transition into whatever you're doing next. So this is what we're doing next. We're talking about what is mindfulness. So in this moment, this slide is looking really big, big words. So hopefully it's a nice size on your end. But this is a definition of mindfulness by somebody who's often referred to as the grandparent of mindfulness in the West. And that is a doctor named Jon Kabat-Zinn, who hails from Massachusetts, I believe, and he has, founded an Institute of Mindfulness and created mindfulness programs that have become well researched and have become, integrated into medical centers and hospitals and cancer centers across this continent and beyond. And so I chose to use his definition because I feel as though it really brings out all of the key points that we're going to be talking through today. So I'll read it. Mindfulness means paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. So notice with this definition that there are kind of 3 key elements that are identified. This intention. So this is purposeful. This is not accidental paying attention. This is very intentional. And the attention piece. So what we pay attention to, we cultivate. We know that. We can pay attention to a plant, and it generally thrives more than when we don't pay attention to it. Similarly, a child or partner. So attention is often the cornerstone of how we show our love and how we share our love. So the attention piece is key here, and the attitude. So you saw the word in the last definition, non-judgmentally. It certainly is, for many of us, one of the more challenging aspects of mindfulness is, what attitude are we bringing to this process? In fact, there are very important key attitudes that we're going to explore after this slide. So this is another way to sort of describe the same thing. But it might just give a little bit more context to that definition that I read you earlier. So paying attention, what does that mean? Well, that could mean, listening, watching, hearing. There are many ways to pay attention or to tune in. On purpose, as I said, that intentionality behind it. In the present moment is another key piece of this. And that is that, to acknowledge that, a lot of the time, we can have a lot of habits around what one of my favorite meditation teachers calls, the leaning back or the leaning forward tendencies of many of us, and certainly of myself. We're either leaning back into the past, leaning forward into the future, and thinking about the present being kind of that place in the middle, that place with our straight spine and our crown to the sky, and recognizing that our power, our choice, our freedom is really in that place. Because when we're leaning back or leaning forward, we're really not able to engage in the now. So in the present moment and non-judgmentally. So, that idea of curiosity and cultivating that curiosity is one of the key pieces here. So as I mentioned, there are important attitudes of mindfulness, and we're going to go through them now. So there's no, magic number here, but I've identified 7 to talk to you about. So the first one is that non-judging piece that I mentioned can be a real challenge for many of us. And many of us do have, in fact, societally or culturally, we do have a lot of tendencies around labeling things as, good or bad. And this can really challenge us with mindfulness, because what we find when we are paying attention is that oftentimes that's what's getting in the way of us maintaining that attention, is this this opportunity that keeps coming up to kind of get lost in the thoughts or get carried away by the thought. And even a good judgment, see, there I did, I used the word good. Even a judgment that we interpret as positive can get us carried away, right? So, I had a moment the other day where I was, having a particularly good, and do you notice those air quotes, mindfulness session. And my judgment that came up was, wow, this is going really well. Wow, I'm good at this now. There's the judgment. And isn't that interesting, right? Because we don't usually think to kind of pay attention to those thoughts when, they're positive. We think, well, how can there be anything, untoward or negative about having a good thought? And it's not that it's negative. It's just that it takes us out of the present moment, right? Because then I'm now comparing it. I'm comparing my experience. I'm evaluating it. I've moved into thoughts. So these are all natural processes. But what I'm describing to you right now are some of the things that we are cultivating in mindfulness. We're not going to get them perfect. I've now had the opportunity, I've been working with InspireHealth for 8 years. We start our day with a mindfulness practice every morning. And what I'm describing to you happened this week. So 8 years in of doing this 5 days a week. So I'm just, it's an ongoing learning process. But the key is the noticing. Judgment, opinion, thoughts. So that's the non-judging piece. Patience. I don't know, maybe it's just me, but what I've certainly heard from working with people over the last 8 years in this area quite a bit is that for many of us, we have trouble not shoulding ourselves around, I should be calmer. My mind should be clearer. I shouldn't be doing my grocery list right now. And recognizing that what really helps with this is an attitude of patience. So we do tend to be impatient with ourselves. And I don't think I'm the only one. And so what builds this capacity is awareness. So noticing when we're feeling that impatient and acknowledging it. Impatience. And the more we notice, the more likely we are to be able to, shift and practice patience in those moments. This one is really important. It's called the beginner's mind. And I had an experience recently of, being with a group of physicians, and we were talking about this concept. And this is maybe something that some of you have experienced, because it's a pretty common practice actually in many mindfulness courses, is to bring all of the attitudes that we're talking about, but particularly the beginner's mind, to a raisin. Yes, in this moment, I'm talking about a dried grape. So you inspect the raisin, you smell the raisin, you listen to see if the raisin, makes sounds as you roll it in your finger. You look at the raisin, I mentioned that already, and then you put it in your mouth, and slowly you experience this raisin in your mouth. And for those of you who haven't tried this before, I would invite you to try it. It's quite, and I had done it before, and still it was like I was doing it for the first time again. And that is the beginner's mind, is this idea of noticing something in a fuller, deeper way and bringing that curiosity to it, and recognizing that we don't always do this. We often are, say, chewing our food without even tasting it. So that beginner's mind, that curiosity, that freshness that we bring to things, that is really going to help when it comes to mindfulness. And it's a skill that really will roll into the rest, have ripple effects. That's the word I was trying to think of. Ripple effects into the rest of our lives, because when we can bring a new attitude or curiosity to a raisin, we cultivating that, think of all the impacts that could have. We bring a new curiosity to our child, to our spouse, to a friend. So that's an attitude that is a really important one in mindfulness. Trust. So there's many aspects of trust, but here the most sort of salient one, the one that we're really focused on in mindfulness practice, is that trust in ourselves, recognizing that we have incredible capacity, that we are our body's most certified expert, that we have a deep connection to our bodies and to ourselves. And for many people, this is an area that does need to build over time. It's not uncommon for us to be or have times of disconnection from our body, and that trust does build over time with this practice. The other thing to know is that this is, and we're going to talk today about the many different facets of mindfulness, and my belief is there is something for everyone in these different facets, and recognizing that for many people, or for some people certainly, working at developing a mindfulness practice really does deserve support, and that it's something that some people would struggle with doing it on their own, or there may be a time that it's not going to be appropriate for someone. So for example, there are examples where somebody has a history of trauma, where some practices can be triggering, and so just really wanting to take this slow and respectfully, and recognize that sometimes when a trust consideration comes up, you're feeling that resistance in your body, and you're noticing that there's a lot of maybe worry or anxiety coming up when this practice is being sort of tried out or sampled. Trust that it might not be the right practice, the right time for you. So that's another aspect of trust as well. Non-striving. So I was reminded, I actually saw this cartoon a couple of days ago, and I printed it out and I put it here to read out to you. So this is a person who's visiting their doctor, and their doctor is standing there with a clipboard, taking notes. The old days when a lot of note taking happened on clipboards. And the person says, "I'm learning how to relax, doctor, but I want to relax better and faster. I want to be on the cutting edge of relaxation." So this came to mind when I was thinking about non-striving, because so much of life is striving. It's not just doing something, it's doing something really, really well, and it's acing it, it's getting it down pat, it's kind of achieving. So a lot of striving goes on in our lives. And so to think about having an attitude of non-striving, for many of us, it's not intuitive at all. And it can be a real shift. But here's the thing. The only goal of mindfulness is awareness. So there are no other goals. There's no goalpost. There's no high fives. You're doing it right. There's no right. There's no wrong. So it's a really, really big shift. And that cartoon really reminds me of why this aspect of mindfulness is really challenging for many of us. So what's often used is the term, and many of you may have heard this, but we are not human doings, we're human beings. So this idea of being with, rather than doing, achieving, scoring, outcome focused. So human beings. Acceptance. So this is a big area, and I'm sure we could actually do probably an entire talk just on each of these 7 attitudes. But this one is one of those ones that really practice makes a big difference in, because again, it's not intuitive. We generally spend a lot of time, focused on what things should be like, what we're hoping for, and not to say hope is not important. It's very important, but what we're quite focused on, what our goals are and what we're working towards, rather than really spending time in what's happening right now. What is our current reality? And recognizing that, some of the time when we're in that now space, there are things that aren't that easy there. In fact, there are sometimes things in that now space that are really hard. So accepting doesn't mean, not having goals. It certainly doesn't mean not having hopes at all. But it means at least spending time with what is and cultivating that awareness of what is, rather than, as I said, that more natural or more instinctive tendency for most of us as adults anyway. By the way, kids are natural in this area in many respects. But as adults, as I say, that leaning back or that leaning forward tends to be more of what we spend our time in. And lastly, letting go. So this goes hand in hand with the acceptance piece. And it's often referred to as non-attachment. So this idea of working to identify that we're often kind of either, anxiously trying to hang on to something that we evaluate as good that's happening, or try to get rid of as quickly as we can something that we identify as bad or negative that's happening. And so this idea of being with what is, accepting things as they are, and not attaching as much to these good and bad labels. So again, it really does, a lot of these things interconnect, but those are the 7 attitudes of mindfulness. And as I say, certainly some of the resources that I'll mention later. One of my favorite sources of support in this area, her name is Tara Brack, and she has talks on all of these attitudes. If anyone really tweaked your mind, your interest tonight, you can look that up for sure. But the source of these 7 attitudes, as they've been described here, is that gentleman I mentioned, that Dr. John Kabat-Zinn. So one of our community members drew this image here, and we really appreciate it. I'm going to go through a few myths about mindfulness. And the number one that we hear on a regular basis is that, you know, this shoulding kind of process, that many people will feel like they should be able to completely clear their mind. The truth is, our mind state is wandering 50% or more than 50% of the time. And the intention of mindfulness is to actually pay attention to that process and to have an awareness of the fact that our mind is almost always doing something. You know, so it's kind of, it's to rein in that wandering. It's not at all to, you know, get that, you know, blank slate kind of mindscape that many people have an idea that we should be, you know, working towards. That's really not it. Another thing that comes up often is people will say, you know, I don't like the idea of that, you know, that I'm trying to escape, or that I'm, you know, that it seems like it would be like me denying what's hard, or denying the challenges that I'm having. And as I was just talking about with the attitudes, it's actually, again, you know, quite the opposite. It is about acknowledging and about being with what is happening, about being, you know, with those challenges. But maybe, you know, having a different interaction or a different relationship with them, being less about, you know, being attached to certain things, or being, you know, caught up in the story or trailed along by judgments, but rather that being with, that acknowledging, and that staying right there in that present, without getting lost in the story of it. So, you know, again, it's not about denying or escaping reality. And lastly, this one comes up all the time, that, you know, the purpose is to, you know, be blissed out, or find bliss, or be relaxed. And you know, no doubt there, I will describe that over the years, I have had some, you know, quite relaxing meditations, absolutely. Some are excruciating. Some are really, really hard. Really, you know, a lot of it depends on what's going on for me that day. And so wonderful if, you know, relaxation is something that you know, that is cultivated, but the awareness and then knowing that for many of us, there are going to be times where things actually kind of rise to the top of our soup pot through a mindfulness practice. That soup pot analogy is often sort of what we refer to ourselves as soup pots, and, you know, things kind of bubble up to the surface for us. So, you know, just realizing that, yes, there can be bliss points for sure, and relaxation for sure, but that's not the purpose. And if things are hard, it doesn't mean you're doing it wrong. You know, it means that you've touched in on something that's going on for you. And it's also, and I just gave this as example, and I shouldn't have, because here I am shooting myself, because it's an example of when you might want to pause. It shouldn't be excruciating. You know, if it's really triggering, or, you know, even bordering on traumatic for you, that's a sign that it's not the right practice, not the right time. Definitely want to pause what you're doing. So yeah, so just as the point is not necessarily to find relaxation and bliss, the point is not to have it be excruciating or re-traumatizing or triggering. So this is a cartoon that we've used for years. So and so have many other presenters. So you might have seen it before, but it's just for me, such a visual reminder of kind of the purpose or the intention of mindfulness. You know, here we have a human with a lot going on in their mind, so much so that they're walking along on this sunny day, you know, not really noticing the sunny day or the trees or anything else, maybe because of the very, very full mind that they have. And you've got the canine creature in this case. Well, I guess it could be potentially a very large cat. And they're, you know, what are they paying attention to? They're paying attention to the sun and the trees and the present moment. So that is a visual that definitely has stuck in my mind as I've talked about this concept over the years. And this quote by James Baraz also really resonates with many people. So we continue to mention it. Mindfulness is simply being aware. I would say it's not always simple, but mindfulness is being aware of what is happening right now without wishing it were different, enjoying the pleasant without holding on when it changes, which it will, being with the unpleasant without fearing it will always be this way, which it won't. So again, that to me speaks to the letting go process that we were talking about, and the recognition that things are always changing, you know. And what do they say? That, you know, generally we experience an emotion for seconds to minutes, and, you know, like kind of like the waves in the ocean, it rolls in and rolls out. And so, you know, even recognizing that process can help us with the letting go piece. And this slide is a tree of contemplative practices from contemplativemind.org, which is a great resource if you're interested. And this is a tree that they produce for use in sessions such as this. And to me, this always reminds me to say out loud that there are so many ways to cultivate mindfulness. And you know, we are sort of in this talk today focusing on sort of a certain area of the tree, more on the left side of your screen there. But just to say there, and I said this earlier in the talk today, there is really something for everyone here in this realm of mindfulness. So, you know, if you're sitting there thinking, this hasn't you know, been something that I've really had much connection with, or I'm intrigued, but I don't know if there's anything there for me. You know, my hope for you is that you keep exploring until you find something that really resonates for you. So I'll shift now to why mindfulness. So I'll first say that the why really, in large part, comes from how we're made. So stress and the experience of stress in our body is a part of life. It's you know, it's how we were evolutionarily designed. We have a nervous system called our autonomic nervous system that is made up of two counterparts that are, you know, are in constant relationship with each other and balancing each other. One is the sympathetic nervous system, which is our sort of arousal system, and, you know, it would be the system that instigates or triggers our stress response, which we'll talk a little bit more about in a moment. And that system is balanced by the other side of our autonomic nervous system called our parasympathetic nervous system. And that those systems work together. You know, often we describe them as working in tandem with one another to support us. So when we when we have an acute stress response, it's important to know that that's our wiring. That's how we're made, and it has a very important survival purpose. Evolutionarily, we needed to have a stress response. We absolutely need to have a sympathetic nervous system to get us out of a bind, or to get us out of trouble, or if you're thinking about in modern day, driving a car, there are times when we need to make a very, very quick decision, to change the course of what's happening, and hopefully get out of there and the best possible outcome. So we need a stress response, and so it's certainly not. This is not to say stress bad. No, not at all. The thing is that when that balancing of that seesaw or teeter-totter between the two parts of our autonomic system is, really weighted towards a lot of that sympathetic nervous system drive, with less ability to get that, parasympathetic nervous system to balance it. We know that has health implications. And it can look different for different people, but and the list is long of what that could involve. For some people, it's when their stress levels get high, they don't sleep well. For other people, they get sick more. For other people, they develop conditions like their sugars aren't able to be controlled, and their diabetes acts up, and we know that immune system function, the restoring and the nourishing of our immune system happens more so in that parasympathetic nervous system. So when there's less of that going on, our immune system can suffer, and so we can develop autoimmune conditions and that sort of thing. So on top of this puzzle or this picture, what we're talking about here today is, a situation where, on top of the regular stressors of life, for many of you, there's been a cancer diagnosis, which brings, new aspects. And then in the last 15 months, COVID, which has certainly brought for many of us, a lot of stress as well. And it's important to say that, when a stressor, particularly a new stressor, has been added to our life, it's very common to, have a stress response. And sometimes that stress response can be experienced in, a state of shock, or there's many ways to experience a stress response. Sometimes it can be quite prolonged. So it's just to say that that's entirely normal. And that's our body's, way of managing that situation. But just to say, and Tara Brack, who I mentioned earlier, does a lot of work in this area. Just to say that that fight, flight, or freeze aspects of the stress response. There might be things in here. I'm not going to go into detail, but I really appreciated Tara Brack's sort of breaking down of these different areas, because it can help us to see, yeah, what? When I am in a stress response, I really identify with, immersing in work, which is kind of more of that flight part of that, or obsessive thinking, which is, when we're kind of ruminating about something and sort of turning something over in our mind, that maybe a more of like a worry habit that we might have. Or, I feel like I often deal with stressors by kind of having a lot of judgment about myself, and that's more of that fight response. So just to say, we all have stress responses, and we can respond in different ways depending on the stressor. We're not always flight or always fight, or there's mix and match going on, but we do tend to have tendencies in this area. And it can be helpful to build an awareness, because then we can see, oh, okay, when I start losing my keys, or misplacing things a lot, that's often the first sign of stress for me. I wonder, like, maybe let's spend a little time and let's look at what's going on for me. So again, this is, I'm giving an example, and it might, seem like a small one, but getting to know ourselves in our stress responses can really be helpful information for us to be able to build in that awareness and put some practices in place that can make a big difference. And the picture of the brain is just to say that, when we're in this fight or flight mode or this stress response mode, really it's our primitive brain, our survival brain, that is really active in this mode. So rather than our learning thinking brain, it's our limbic system that's most active when we're in our stress response. So that has implications when we're thinking about, making good decisions and communicating effectively with our loved ones. We recognize that being in that front part of that brain, that learning thinking brain, is really, a much more optimal place to be in, rather than that survival brain for those purposes. So that brings up the naturally built into our body system, our parasympathetic nervous system, that relaxation response, that offsetting of the stress response. And Jon Kabat-Zinn, one of his most famous quotes is, "You can't stop the waves, but you can learn to surf." So just to say, we're never going to be able to stop the stress or take it all away, but we can learn how to ride those waves, learn about our body, learn about what triggers us, and learn about how we can help ourselves to promote that relaxation response. The parasympathetic nervous system is often known as rest and digest. And I find that to be very helpful, because it reminds us of two really important functions that happen when this part of our nervous system is activated. And that is, we're able to rest, and to rest deeply. And we know that sleep is really restorative for our whole system, our mental health, our nervous system, our immune system. And we're able to digest our food. So, they've done studies looking at two groups of people, and they both watch something stressful, and then they eat a meal, and they kind of follow the digestive pathways, and then they compare that when they instead of watching something stressful, they do a mindfulness practice, and then they eat something and they watch how that digests. And it's remarkable, probably not surprising to anybody here, but it's remarkable how many more aspects of our digestive system are functional when we've just done a mindfulness practice, versus watch something that's really increased our stress hormones and gotten us into that stress response potentially. So the other thing that we know is activated in this part of our nervous system is that newer part, as in not that primitive part of our brain, but the higher level executive thinking, decision-making part of our brain, and also that our immune system is stimulated. Like I'm sure this frog laying on the lily pad's immune system is in this moment. So another thing to say about mindfulness, and why is it important, is that, and this is just one example of a well-done study, but there's more and more research in this area that has established that particularly for two of the most common mental health conditions that we deal with in North America, anxiety and depression, that mindfulness can make a significant difference. The two most commonly researched tools in mindfulness are two programs that have been designed, and I think I mentioned Jon Kabat-Zinn's program, Mindfulness-Based Stress Reduction, earlier. So it's often referred to as MBSR, and this is the program that he developed way back in the 70s and 80s, and has just grown in popularity and in use and spread now. I think most cancer centers across the country have MBSR programs that they offer for patients, for people with cancer to participate in. So this is, really well-established program. And then a sort of a secondarily developed program, mindfulness-based cognitive therapy, quite similar. They share a lot of the foundational principles, but there are some, key differences that I won't get into today. But two really well-established programs that they looked at that they look at in lots of studies to see how they work and what benefit they can provide. And the good news is, not only do these programs provide benefit for anxiety and depression and reducing amounts of anxiety and depression, the results persist. And so, you're looking like 3 months out, 6 months out, 12 months out. And these people who have gone through the program have maintained the results that they achieved from the program in the areas of their mental health. And when they compare these programs to these interventions to, just educating about mental health awareness, for example, or things like relaxation therapy or supportive psychotherapy, the mindfulness-based programs outperform those others in effectiveness. So quite compelling. And then when it comes to cancer, there's lots of exciting research, especially in the last decade or so, around mindfulness and mindfulness-based programs, particularly in cancer populations. And one of the researchers in North America that has done the most work in this area is a researcher, a psychologist and researcher out of the University of Calgary, named Linda Carlson. And she's written a book, Mindfulness-Based Cancer Recovery, and designed, it's basically an MBSR, a mindfulness-based stress reduction program for cancer recovery. And in her research and in her papers on this work, she lists so many really compelling reasons to be very intrigued and interested and hopefully inspired by this work, including all of the areas where quality of life improvements are seen, reducing fear of recurrence, improving relationships, especially around the skills of emotional regulation, increasing self-awareness and feelings of empathy and compassion for oneself, improving in the areas of attention and memory. And this is an area that, I often find patients are surprised when I say, I would really, I'd encourage you to consider a mindfulness program. And I said, you've been describing how many struggles you're having with your attention and with your memory. Do you know that this can be really helpful in this area? And, it's often a really big surprise to people. And then I'll sometimes get into some of that neuroscience that I just talked to you about and explain why that is. Healthier bodies, we just talked that through, but you can see the connection there. And just across the board, seeing decreases in stress, anxiety, depression, pain. So there are mindfulness programs, particularly in the area of pain, and pain from either side effect of cancer itself or side effect of some of the treatments. So really quite remarkable work. And many of the cancer centers nationally have used Linda Carlson's work as to inform their programs. A very busy slide, my apologies, but I just wanted to say that more recently, just in the last few years, there's been more research looking at mindfulness in the area of advanced cancers, and they are seeing some good results and effectiveness, even in really, sort of later stages of cancer for people who can engage in a program. And generally the settings in this case are in home settings. But just to say that this is hopefully, we're going to build more and more accessibility for this to be a tool that could be used throughout the sort of the trajectory of cancer and of life. So I'm now going to move into tools and practices. And I'll just say that this is a long list, but part of why I sort of put it all on one slide was just to say that there are so many options. And I mean, I haven't even exhausted the list here. And you saw that tree, that contemplative tree earlier. So this could be, 5 times this length. But just to say that we're going to go through a couple of examples here. And again, think of it more like planting seeds, because to try each of these things out would be when you'd really get a sense of like, is this kind of thing for me? I don't know, but my hope is that you might think, that 5 senses thing that Hannah mentioned sounds kind of interesting. I'm gonna look that up and try it out. And I mean, that is one of the wonders of the World Wide Web, in the sense that you really can look up and find anything that you've heard about here, find an example of it. You don't like that person's voice, find another example of it, try these things out and see what you think. So I'm gonna go through these each by each here. So this is an example of a tool that you could really have in your back pocket. In fact, some people have said, for some people, this graphic doesn't work at all. And for others, I've had people say, I'm going to, print it out and put it up on my mirror in my house, or I'm going to put it on my, steering wheel in my car. But it's this idea of a really quick practice that reminds us that we can take a mindful moment, and it can help us throughout our day. So the acronym is STOP, hence the stop sign. And the process is, first, S for stop, easy to remember. T for take a breath. And, 1 breath, or if you feel compelled, a breath or 2, I would say. So a really intentional, mindful breath in and out. Doesn't have to be deep. It can be whatever you'd like, but just a really intentional breath. And as you're doing that, and maybe even for a moment after you complete that mindful breath, observing, looking around. When I was practicing earlier today for this talk, I actually noticed that in a painting that's been on my wall for my entire time at InspireHealth, and even before, because I had it in my office of family practice, there is a chili pepper in my painting. It was a painting given to me by a patient many years ago, but smack dab in the middle of the painting, there's a chili pepper that I had never seen before I was doing this practice earlier today. So compelling evidence. I can't think of a more compelling evidence. Just quite remarkable. I'm still amazed. And then proceed mindfully. That could mean many things, but if you're worried, what does that mean? And will I do that? And what does it take to do that? You will, because you've paused. That's the whole thing. The next couple of moments will be mindful because you've taken this pause. So you don't have to worry, far be it for me to tell you what to feel, but it just will because you've paused. And so that's a practice. Stop that you could take into your life if you'd like. Sometimes people have said that they use it when they're brushing their teeth, or some sort of habit that they have that they do regularly. They incorporate this practice into that. This is another one. This is one of my kids' favorites, so I thought I would include it. It's very accessible, and you don't have to do it in a way that everybody sees what you're doing, although go for it if you'd like. But you can also do it with your hand in your lap if you like, or after you've practiced for a while, you may not even need your hand, but you'll just be so used to doing it that the hand visual will remind you of it. But basically, you're using your hand to take 5 breaths, and you're going, you could do inhale, exhale, or you could just do the simple one, which I like to do, in, out. So in breath, out breath, in breath, out breath, in breath, out breath, and so on. or inhale, exhale. 5 simple breaths in the palm of your hand. It's another tool. For some people, gratitude is quite appealing, or maybe it's new and you're thinking, this sort of sounds like could be a mindful practice that would resonate for me. So there are just a couple of examples of some options in the gratitude area. So many people find either journaling in general or a specific journal practice around gratitude. Maybe you're writing, 3 things that you're grateful for at the end of every day, kind of thing. So that's an example. Some people find that sharing their gratitude really makes a difference for them and gives them that perspective of what they're grateful for. So maybe, writing a letter of gratitude to somebody, or calling somebody up, or, writing a gratitude text. So yeah, that idea of sharing what you're noticing, what you're aware of in the area of gratitude. Gratitude ABCs is an opportunity to go through the alphabet. I always say to people, you don't need to do all 26 letters, but maybe pick a section of the alphabet or spread it out over 3 days and do the alphabet. But then you pick something specific that you identify with, a feeling of gratitude towards. So I might say apple. I do love apples, actually. I'm from the apple orchards of Nova Scotia. So, and then I might say B for boat. I love boats, and I really hope I get out on a boat this summer. C, for my cat, my furry friend. So picking something that you're grateful for that starts with the letter of the alphabet. And then this ties in with the last one there. Be specific. And if it works and the analogy works for you, feeling it in your body. So something that you're grateful for, maybe it's, instead of saying, although this isn't bad, but, instead of saying I'm grateful for my body, you might say, really grateful for my feet, how they carry me through this life, and for their, endurance and resilience. And then as you're saying it out loud and kind of marinating in it, feel your feet. Maybe you wiggle your toes, maybe you just take your attention there, feel the sensations in your feet. So grounding yourself in that practice. This one I'm not going to go through, but this is the 5 senses one, where you identify 5 things that, well, I guess here I am going through it, but 5 things you see, then 4 things you hear, then 3 things you smell, 2 things you can taste. And then you often go through each of those senses. 1 thing you can touch. And then you often do a round where you go, okay, 1 sight, 1 hearing, 1 smelling, 1 tasting, 1 touching. And there's no, again, wrong way to do this, but it's a very powerful grounding practice. And sometimes people will describe that, if they're having a moment of acute stress, forget about the whole practice even, but just even saying, okay, I'm going to, identify 3 things that I see, and maybe bring that beginner's mind to it and look at them as though you're looking at them for the first time, like I did with my chili pepper in my painting over there. And see if there's a noticing there, and then maybe take it to another sense as well to sort of ground your body. So that's a 5 senses mindfulness practice. And then again, we could do a whole talk on compassion, and we do at InspireHealth, and I know there's lots of wonderful talks available online as well. And Kristen Neff's work in this area is very powerful. If you're interested in the area of self-compassion, really do look up her work. But she is quoted as saying, treat yourself as you would treat a good friend. And what we know about compassion and kindness for ourselves is that the more we're able to practice and cultivate whether it's a loving kindness meditation, or, there's lots of ways to use meditation or mindfulness in this cultivation practice, that we when we cultivate it in ourselves, it spills over and impacts our whole life. And what we're able to feel for ourselves, we're better able to feel for others, and it improves our connections with others as well, these tools. So self-compassion. And then just to say, to be with your emotions compassionately. This is just a couple of tips, but Kristen Neff's work, and also Tara Brach talks a lot about these processes as well. Identifying what you feel and how, and allowing yourself to feel that way, rather than what we often do is, oh, I shouldn't be feeling that, and kind of the tendency that we have to kind of push those emotions down. Recognizing that it's a shared experience. Kristen Neff's work calls it shared humanity, recognizing that there's more similar between us than there is different, and that a lot of our experiences, there's going to be others that would really identify with that and would have had similar experiences. And that can help us, that can help normalize what we're experiencing. And then meeting that emotion with compassion by asking ourselves, what do I need? And so often when emotions are coming up, especially if they keep coming up, those emotions are, they're messages to us, and they're important information about what's going on for us and what we might need. So this is that same slide again, but just to say that, some of the practices can be super simple, and that can just be to do what we do in our day-to-day life, but just bring a different awareness to it. So if we're washing our hands, that's all we're doing. We're really noticing the water on our hands, the soap on our skin. We're maybe noticing the aroma that's coming up from the hand soap. We're feeling that water touch our skin. We're, really mindfully drying our hands after. And similarly, when we walk or when we eat, really being present and participating, being curious, bringing that beginner's mind, really bringing our whole selves to that experience. And then just a note, because it is so important right now in our day-to-day lives, that most of us do carry very powerful computers around with us, called our smartphones. And just being aware that, oftentimes one of the things that gets triggered in our stress responses actually is to kind of dive into that immerse ourselves, distract ourselves with things on our phone. And there's, it's not to sort of label it as, as a bad thing, but just, to bring that awareness and notice. And notice when we're really, being drawn to that phone, when, maybe that is our time to do a mindfulness practice and connect with ourselves in a more sort of a way that's going to serve us more and support our health better. Yes, that's a reminder for me to take a breath and a sip. So, there's a poem here that I thought I would read. Dana Folds she writes a lot about mindfulness and meditation. And this is one of her short poems that I really love, and it's called Being Present. So here it is, being present. Breathe, relax, and feel. Take time to slow down the pace of life. Watch the rise and the fall of moods, the birth and the death of dreams. Feelings and sensations seem so real, yet they shift like changing clouds and flow with the high tide out to sea again. Allow it all to be, No need to grasp or push away. Present with each moment, the whole of you, body, mind, and soul, open to receive. So that's Dana Folds. Lovely. So I didn't realize this picture isn't very clear, but this picture has been in our circulation because this is for some time. This is John Kabat-Zinn at a mindfulness conference doing a body scan in a crowd of people doing a body scan. And I had an interesting experience recently seeing this slide again for the first time since COVID. And my first reaction was, oh my goodness, look at how close all those people are to each other. So it was a really important awareness for me to notice that, I'm definitely bringing a different sensitivity to everything right now. And I think many of us are. And so this is not a picture to say, find yourself the nearest convention center and lie down on the floor with 100 or 1,000 other people. But it's to say that the body scan is the basic, the foundational meditation of the mindfulness-based stress reduction. And so if, as an endeavor, some of you on the call here, or on the talk here today, decide to pursue mindfulness-based stress reduction, the body scan is one of the tools that you will experience and that you'll practice on a regular basis through that course and hopefully beyond. And it's a really foundational and accessible tool where you pay attention to your body and pay attention to the sensations in your body, and you bring an awareness to those sensations. And what I'll say is that, one of the things that I noticed is that I've taken MBSR and I had tried to do a body scan many times before I took the course. And one of the things that really shifted when I took MBSR was to know that it was normal for this to be hard. And it was normal for it to be, for you to have areas of your body, and sometimes, vast areas of your body where there weren't accessible sensations, especially at first. And the more we practice the body scan, for most of us, we build that ability to feel things in our body. But we don't necessarily start there. So if we have more time today, I just want to make sure I save time for some questions if there are any at the end. But yes, a body scan, you can find one online, and you can choose a 5-minute version, a 15-minute version, a 30-minute version, and try out a body scan. And I would highly recommend it, or consider a mindfulness-based stress reduction course if you'd like. They're generally 8-week courses. So I'll just say that Pema Chodron, who's she's a Buddhist meditation teacher, and she has many amazing quotes. But one of them is, "You are the sky and everything else is just the weather." And I really appreciate that analogy of thinking about, things that are happening for us in our lives and our thoughts and our emotions and our moods as being, weather and passing weather. So just to say one moment about resources. I've mentioned a couple of times this MBSR course, and just recognizing that there might be one near you, or of course right now, there might be one that's available virtually if you're interested. And then just to say that I've included the website for Linda Carlson's work out of the University of Calgary. There's just so many, and there are other courses too, of course, but there are so many websites. I really was struggling which ones to mention, but my local, although a lot of his work is national, especially during COVID, but my local mindfulness teacher, a colleague, Mark Sherman, has a wonderful website with a lot of resources on it. So I wanted to mention his website. Tara Brack, who I've mentioned, mentioned, the University of California, San Diego has a center for mindfulness that has a lot of great resources. I mean, there's just so many resources out there. It's almost, it's almost hard to decide what to put in here, but there's also a great website called Free Mindfulness. And then there are so many apps. Yeah, I just mentioned a few here, and I know the session is being recorded, so you can come back to this slide if you need, but Insight Timer, there's a great free version, Calm, Oak, Smiling Mind. And just to say that we do have that workshop on mindful communication next week happening that, of course, you'd all be invited to. And I'll end there, and just to say, yeah, we're here and available if you'd like to connect with InspireHealth as well. And now I'll open it up for any questions.
Thank you so much, Dr. Nette. So much of your presentation resonated with me. One question here I have from Donna is, do residents of Canada have access to InspireHealth's virtual program, or are they for BC residents only?
Oh, thank you. That's a great question. And I'm really glad you asked, because I'd hoped to say that at the beginning, but if I didn't, I'm sorry. Yes, we are. Our services are available right across Canada. We do, at this point in time, we are Canada-based, not beyond Canada, but yes, we are across Canada and available. There are, I mean, right now, all of our services are online, but, going forward, even as COVID passes and we get more comfortable with especially those one-on-ones happening in person, we will, of course, be opening our centers up to do that again. But we're not going anywhere with the online program, so we're going to keep many of them online, so to increase that access and availability. So
that's excellent. Now I have a question for you. This is coming from myself, and I really loved when you said we need to focus on being a human being, not a human doing. So in my life, I have 3 kids. I'm a human doing, I think, a lot of the time, and I try really hard to practice gratitude, is one of the things that you had mentioned. But oftentimes the human doing part makes me fall off that wagon. So what do you suggest for longevity, I guess, in a mindfulness practice? I think it's really easy for me, like, to start something and I'm keen and I'm gung-ho for like 6 weeks, and then all of a sudden it's like, oh, I can't now, I'm done.
Yeah. And I mean, I would say your question is probably the most common question that we hear, that we get, and that we all have personally. I've now taken, I'm embarrassed to say how many mindfulness courses I've taken. I won't even say the word out loud, but so many. And when you go around the beginning and you ask people, why they're there, so many people, and I myself included, say, I want to develop a sustainable practice, and I'm back again to see how I can make this happen for myself. Or, I practiced for a while and then something came up and I stopped, and the habit kind of, went by the by, and I'm here now. So one of the Mark Sherman, who I mentioned, has been one of my favorite teachers. His phrase is meditate anyway. Even if you only have 5 minutes, just do something, because so often we say, I don't have time for that 30-minute body scan, so I'll just not do anything. But there's so much value in the 1-minute pause or the 5-minute breath practice. So the goal in whether it's a course or a practice development is to practice and build something that's going to be sustainable for you, and pick a time of day. So for many people, where they've stumbled, and myself included, is to say, okay, yeah, I'm going to do this at some practically completely unrealistic time of day, like at 8 p.m. before I'm too tired, but after my dinner dishes are done. And you know what, I'm usually too tired even by 8, so I fall asleep. And not that there's anything wrong with sleep, but it's not the same, right? So, often earlier in the day, and maybe it's a lunch hour break, or maybe it's that, you you're setting your alarm and getting up 10 minutes earlier and doing a 10-minute practice in the morning. But, building in something that's realistic and recognizing that it's all valuable. 1 minute, 5 minutes, or 30 minutes.
I have a comment here now, and I 100% agree with this comment. It says, I love your idea of focusing on the photo of your favorite place and just pausing to breathe each day. She's already deciding which will be the focus for her. So thank you.
Oh, how wonderful.
I myself too, I noticed when you were talking about the stop analogy, stop, take a breath, observe, and proceed mindfully. I walk early in the morning, usually at 5:30, and I find myself when I'm in the gratitude mode, I guess, I totally notice myself just stopping and enjoying the things that as a human doing, you can't do. The sunset, the sunrise, the animals, the birds, anything. And it's so calming and peaceful. And it's just a beautiful start to my day. I feel so grateful for what's to come.
Yeah.
I have
so
one more.
Stephanie, so you're already doing a mindfulness practice every day with your walk.
Yeah.
Yeah. No, truly, that walking meditation is a big thing.
I want to be, because I'm learning. I have one more question here, and what does recognizing stress triggers, where does recognizing stress triggers figure into the mindfulness practice? Thank you for this comic talk, she says.
Oh, good. You're very welcome. So for many of us, it's quite directly connected. So when we're building that ability and that sort of paying attention to what's happening for ourselves, and we're noticing, and I mentioned, something that trying to remember the examples that I gave, but the example that I gave earlier of, that's one of those first signs of stress was definitely something that I identify with. Then pardon?
Losing your car keys.
Yes. So, that flustered morning thing where nothing is where it's supposed to be. And, then you spill coffee down your shirt. Yeah. So in that moment, I'm usually still able, if I can pay attention, then I'm still able to mindfully say, I need 3 breaths. Or, I need to pause and be 5 minutes late because I need 3 breaths, and or 10. So if we're able to recognize before we're in that kind of more full-blown stress response, then we still have probably our thinking brain, or at least part of it, online enough to say, this is an opportunity, and to bring in one of those tools. Maybe it's a diaphragmatic breath with our hand on our belly, maybe it's a stop, maybe it's a grounding exercise where I'm, listening to the birds chirp above my car before I drive, so bringing in some of those tools and building that awareness of what's going on for us. And when that stress is kicking in is one of the first steps. So,
thank you.
Oh.
That's all the time we have for this session. I really want to thank you so much, Hannah, for sharing your time with us and sharing your expertise. And thank you to everyone else who joined us. I know for me, like I said before, a lot of this resonated with my life, and I appreciate all of the help and the comments and the tidbits that I can make it easier going forward. So thank you for that.
It's an absolute pleasure. Thank you so much.
So I now just wanted to, everyone who's still on the webinar here, your feedback tonight is so important for us, and it really helps us to shape these sessions going forward from month